Hello, everybody. This is Dr. Andrew Campbell. And today we're going to discuss in this webinar the hidden risks of breast implant illness, exploring these risks. As you know, in all my lectures, these are all based on scientific and medical facts, published studies. This is not opinions on from various websites over the internet, but actual medical and scientific facts. So these are true, and they're absolutely show the medical evidence. Okay, so I want a disclaimer. I'm not telling you to do anything or follow any kind of a treatment or anything. So here's what I do. I'm the editor-in-chief of 3 medical journals and the co-editor of a 4th one. The medical advisor, I'm a reviewer for two medical journals, and I'm on the editorial board of 4 other medical journals. And I lecture pretty much all over the world at various medical conferences and university medical centers. And all information that I provide you is to educate. It's not for me to make any money. I'm not one of those experts on the field. I just heard that there's this one doctor in Colorado, and she charges $3,500 for her first visit. I can send you to see the #1 neurosurgeon at Harvard University, and he doesn't charge that much. So, okay. Here we go. So over time, they've been called different things. And so sometimes you may read something and it might say this or that or the other. I'm here to clarify that for you. It was first called about more than 30 years ago, SIDS, silicone-induced immune dysfunction syndrome. Then silicone breast illness came along. Thirdly, ASIA was coined by Dr. Schoenfeld in Israel. This is autoimmune inflammatory syndrome induced by adjuvants. What's an adjuvant? Something that stimulates the immune system, like the shell of the silicone of the breast implant, and of either whether it's saline or silicone. The shell is still silicone, and so that irritates and affects the immune system in an adverse way. And the one that many, many people are familiar with is breast implant illness. Now, the key to solving medical problems caused by toxins, and remember, toxins can be, there are millions of toxins, but just to bring some off the top of my head, there's heavy metals like mercury, platinum, arsenic, etc. There's toxins that come from molds. Those are called mycotoxins. And there's toxins that are created by laboratories. For example, formaldehyde is a toxin. So how do you solve problems coming from toxins? You detect the cause, know which one it is. Second, remove it. Okay, the first rule of toxicology is get the patient away from the toxin or the toxin away from the patient. And third, you repair the damage. Once you've done these 3 steps, the patient is well. Size matters. I want to tell you about spores and mycotoxins as an example. Hair is 100 microns thick. Spores from molds are about 2 to 4 microns. Mycotoxins are 0.1 microns, the same as the famous COVID virus. So exposure to mycotoxins is mainly by inhalation. You're inhaling it, absorbing it through your skin, not so much from anything you eat. So let's start on symptoms related to breast implants. And this is a study that came out last year. So cognitive problems, these are symptoms, okay? Brain fog, joint and muscle aches and pains, severe debilitating fatigue. I'm not talking tired. Tired is when you mow the lawn in the middle of summer in the heat of the day, and then you may be tired from doing that. Or if you've taken a long trip somewhere, you may be tired. I'm talking fatigue. It's quite different. You go to bed fatigued, you wake up fatigued, it severely limits your activities. The other symptoms, POTS, paroxysmal orthostatic tachycardia syndrome. So you don't treat the POTS. You treat the problem that's causing POTS, okay? Just so you understand this. It causes motor and sensory neuropathy, the third point. What does that mean? Sensory is feeling. What that means is touch, pain, feeling things. Motor is movement. So it's harder to move. It's easier to trip and lose your balance. It's muscle weakness. Those are sensory and motor neuropathy. The nerves leading to your senses and to your muscles aren't working as well. This was demonstrated in a chapter that's been published in a medical textbook. I'm the lead author, and there are several doctors with me on that study, which we completed years ago. Then there is your lymph nodes, your lymphadenopathy, meaning enlarged lymph nodes. These could be in your armpit. These could be in your groin or other places. Sjogren's like dry eyes. This is where your eyes feel dry all the time, constant. Raynaud's phenomenon. This is spasm of your blood vessels, especially in hands and feet. So if you look at the palms and fingers of a normal person's hand, they have they have a hue to them. With Raynaud's phenomenon, they turn white. Blood is not getting to them, and it's not a very comfortable situation. Mast cell activation. Mast cells are cells that are found at every entrance to the brain. They're found throughout the respiratory tract and throughout the gastrointestinal tract. And they're also found close to the surface of the skin. Normally, what these mast cells do is they produce histamine and heparin, which is, say, the person's allergic to cats, and you go see someone who has a cat, and you start itchy eyes, itchy nose, or there's welts and things like that. Okay. But when it's a toxin, mast cells will release substances that contain what we call interleukins. These are cytokines. This is all clinical immunology, but basically it releases substances that create inflammation throughout your body. Then there's stroke-like symptoms. You feel like you've had what we call a mini stroke. That's called a TIA, or transient ischemic attack, but it feels like a momentary stroke. Sorry for mentioning lymphadenopathy twice. And then lastly, there's hair loss. So your hair starts falling out. It's all over your pillow when you wake up in the morning, when you wash your hair, when you dry your hair with a towel, etc. Here's 200 patients with breast implants followed over 30 years. Okay. So the 54 of them underwent explantation. They had the implants removed. Of these, only half improved. So if you get explanted, this tells you two things. One, you may not improve, and two, you have to have more treatment than just removing the implants, okay? Then the other risks during the normal manufacturing processes of breast implants, they use platinum as a catalyst. Platinum is a heavy metal. Heavy metals affect very strongly the brain and bone, B&B, brain and bone. There were traces of lead reported, but these fell within the permitted regulatory guidelines. And just as importantly, breast implants are also endocrine disrupting chemicals. What does that mean? It disrupts your hormones. Thyroid hormone, estrogen, progesterone, testosterone, cortisone, all the things, all the many hormones that the body makes. And what's especially concerning about this is that what happens if a mother with implants gets pregnant? These can affect the developing fetus. Other risks, and as you may have already heard me discuss this in previous webinars, and that's they were first marketed in 1962 to doctors in Houston, developed these with Dow Corning. So now there's been attention looking at a type of cancer known as anaplastic large cell lymphoma, okay? And you can see the letters in the parentheses BIA, which stands for breast implant associated anaplastic, ALCL, anaplastic large cell lymphoma. What are the symptoms? Brain fog, hair loss, fatigue, chest pain, sleep disturbance, irritable bowel syndrome, headaches, chronic pain all over the body, and unusually, and commonly, I should say, autoimmune diseases like lupus, fibromyalgia, etc. If some of you are saying, gosh, this also sounds like symptoms from molds and mycotoxins, you're absolutely right. In this study that was published 2 years ago, this month, 2021, from Netherlands, Holland, they say that Dr. Brautbar and I proposed that there was evidence back in '92 for a direct cause between implants and disease, breast implants. This means that silicone implants sweat, releasing silicone particles, and these particles can end up inside the capsule or migrate into the surrounding tissue in the breast and in the body. What that means is, by the sweat, is if you put a silicone implant on a paper towel and leave it there for 30 minutes and lift it off, the paper towel will have a oily circle. In other words, implants ooze silicone or sweat silicone. This is serious because that silicone doesn't stay in one place. It'll go to many different places throughout the body. So here's this study on 389 women with silicone breast implants. 98.8, just short of 99%, had silicone particles present in the tissues, indicating silicone gel bleed or sweating or oozing. Okay. Out of these, in 337 women, 86.6%, silicone was observed outside the capsule in tissue, lymph nodes, indicating silicone migration. And in 47 women, the silicone was inside the capsule. The rest was outside the capsule. Out of these, 6 women developed the breast implant associated cancer. And in 5 women out of 389, only 5 had no silicone anywhere else. That's important to know. What were the conclusions of this study? That in 98.8% of women, there was oozing. And in 86.6%, the silicone was found in other places that had oozed out. It was found in different tissues. So here's these 2 studies. One that I was involved with back in 1995. As some of you may know, I've been treating patients with silicone breast implants for well over 30 years. And I published 23 studies, a total of 23 studies. In this case series of these, all these women we've been talking about, what they are saying is that they go everywhere through the tissue, surrounding connective tissue, fat tissue, muscle tissue, lymph nodes, irrespective of the type or brand of silicone breast implants, including non-cohesive and cohesive silicone gel. And what we said 28 years ago, that these silicones are not inert, that they can induce cell death and have mutagenic effects. In other words, we concluded back then that there were delivery systems of silicone molecules throughout the body, regardless if they don't rupture, because their contents are a mixture of various size compounds, smaller than the spores of the shell, and that bleeding, oozing, sweating had occurred. By the way, if anybody wants the 23 studies on breast implants that we did, let me know. I did them with other doctors, so it's I'm the author on some of them. On some of them, I'm the co-author. Here's a 34-year-old female who had one-sided mastodynia, meaning breast pain, just on one side in the left breast. They took out the whole implant with the surrounding tissue. That's called a capsule. It's the scar tissue that forms around the implant. And you can see here's a picture. Okay, here's a picture of a 34-year-old presenting with bilateral breast pain. And this is this case, and this shows the capsule, and this shows the implant. Now, implants, these are yellowish. Can you see? And discoloration on the inside. I don't know if the picture is good enough on your screen, because they have things inside them. What do they have inside? Molds. So here's a 29-year-old. You think these are clear silicone gel, like when they're put in? Obviously not. And here's this capsule, the scar tissue. These are saline. These 2 are saline implants. So yeah, it doesn't matter which one. Now, here's another one. This is a 47-year-old lady. again, left side breast pain. And this was a silicone gel implant. And you can see how it's kind of a muddied look. It's not clear. Okay. And here's another one. On the left is a normal implant. You can see through it. And on the right, what do you think that is? Silicone implant or saline with molds. So what are the steps to take? What can you do? And this is the important part, because I get women, I see patients, and they have implants, and they come to me, and they're scared to death to do, they're not scared to death, but they're affected, they're nervous, they don't know what steps to take. Should I have them removed? Should I wait? What should I do, doctor? So I tell them, first, do the mycotoxin antibody test to see if this has molds in them. And if you test positive, well, then you treat for these molds and the mycotoxins they carry. If after treatment, there's no resolution of symptoms, then take the step, which is explantation and treatment. What happens if you do the treatment and you feel well? Then you don't need to do the explantation, because you've killed what was inside causing the problems. Not everybody is going to respond to, say, the metals, the platinum. Some are and some aren't. So this is why I take these steps. I don't put everybody in the same category. Every human being is unique and different. Every woman's immune system, every human being's immune system is unique and different. You know of people, for example, who get the flu, and for 2 days they're sick, and then they're fine. And other people, they're bedridden for a week or 10 days. Everybody responds differently. So don't just rush into the, and try to do something without thinking it through or talking to a doctor who knows and understands this. And then here's a result of what happened from one patient of mine. As you can see on the left, she was positive, but look at the right. The right side showed IgE antibodies. What are IgE antibodies? This is the mast cells that we were talking about. She had a lot of inflammation. Now, if you have a lot of inflammation and you go have surgery and you didn't do this test and didn't know, you're going to have a much more difficult post-operative period. So it's best to treat first and see how you feel. Just to kind of help you understand, these mycotoxins, especially IgE, make the mast cells release what are called interleukins. I mentioned them before in this lecture. I'm going to mention them again. Interleukin 6 tells the immune system to cause a lot of inflammation. It creates a lot of inflammation. Interleukin 6, okay? It's a cytokine. And this interleukin 6, I'm going to show you some things about that in just a moment. Here's a normal test. See the difference? People ask me that. Doesn't everybody have, or blah, 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 blah? No, here's normal. And by the way, that column all the way on the left, that's kind of a light gray, light blue column, this one right here, that's normals. Anything beyond that is a positive. So, what's the most precise and accurate test for mycotoxins? It's antibody testing, not urine. Urine is worthless. It just tells you what you're excreting. And they don't test for the actual mycotoxin. They test in urine for the metabolite. And if that's written in clear letters up at the top left of that urine test. What does that mean? If you and I go to have lunch somewhere and we eat, among other things, asparagus, for the rest of that afternoon, our urine is going to smell of asparagus. That's the metabolite of asparagus. Are you really interested in that? No. Again, it's the most precise test, and I've shown that in many, many of my webinars. Treatment. In treatment, I frequently use itraconazole. So this is from a study showing itraconazole, also known as Sporanox, is a common antifungal agent that was developed in the 1980s. It's been in clinical use for 35 years with an established safety record. This is what the medical literature says. If you go ask Dr. Google, it's going to tell you all kinds of horrible things that this does. Well, they're wrong. This is what the real studies show, not Dr. Google. And let me just show you about IL-6 that we mentioned. Long COVID and elevated IL-6. Elevation of interleukin-6 at infection was associated with an increased risk of developing post-COVID, also known as long COVID. And just to show you a little more, during COVID, because we were all kind of shut in, we did not go out anywhere, etc. What happens? There's a lot more fungal diseases from what? From the contaminated indoor environment. There were homes with molds in the home. And that's where you get long COVID from, as shown in these studies. So long COVID and the treatment with itraconazole. So the story, to put it together for you, during COVID, people stayed at home. Many of these homes had mold growth. They developed mold, which brings with them mycotoxins. Mycotoxins cause the release of IL-6. And then you develop long COVID. But if you treat it with itraconazole, you get better. You see? So, I want to encourage you to watch the webinars I've given on MyMycoLab's YouTube channel. There's about 40 of them. Remember that every Wednesday, I give either a webinar or a tea time with Dr. Campbell. Tea time is a time where you can ask me any question in medicine, whether it's heavy metals, breast implants, Lyme, molds, mycotoxins, et cetera, et cetera, et cetera. You can also ask about treatment because there's so much misinformation in Dr. Google. The bottom is my website. And at the top is my email address, Immune Doctor. If you have any questions, please send these to me. And I hope you've enjoyed this webinar. I deliberately made it a little bit short because there's a lot of information. And because of that, I wanted you to absorb it as much as possible because there's a lot more information. I also gave breast implants part 1 and part 2 webinars last year that you can also watch. And now I'm hoping all of you get well. Please send me any questions. I'll be happy to answer them. Thank you so much. Have a great day.